Welcome back to this special hour of Morning Joe. We asked you, the viewers across America, to submit your questions to our panel of health experts over social media about what to expect in the weeks and months ahead. Let's get right to one of them. To answer our questions, we have NBC News medical contributor Dr. Vin Gupta, epidemiologist at UCLA, Dr. Anne Rimoin, Morning Joe chief medical correspondent Dr. Dave Campbell, and Dan Hilferty, CEO of the Independence Health Group, the sponsor of this special hour of Morning Joe. Independence Health Group is the parent company of health insurer Independence Blue Cross, an insurance provider for Comcast NBC Universal employees. Let's get right to it. Dr. Rimoin, I'll begin with you. This video question came from a viewer named Carol. Let's listen.
When the vaccine becomes available, how will the public be persuaded that it's safe?
Dr. Rimoin, the question of a vaccine is one we've gotten from a lot of viewers this morning.
This is a very good question. Vaccines go through a very long process of vetting for safety and efficacy. And right now, these trials are all starting. And I believe that what's going to happen is that the public is going to be aware as these vaccines are being developed. We've worked very, very hard in other epidemics, like in Ebola, to be able to roll out vaccines quickly and to be able to work with all of the various communities and show them that we've gotten all of this data. So I think that this is going to be extremely important right now. There are always a lot of questions about vaccines. And so I think that everybody, as they are ramping up, will be spending a lot of time showing people the data and making sure that people feel very comfortable with it.
Dr. Gupta, this one for you. Jerry writing on Facebook, with reports from China and Japan about survivors becoming reinfected, which implies they did not form antibodies during their first infection. How successful will a vaccine actually be, Dr. Gupta?
Thanks, Willie. These reports have been concerning to all of us, and we've been trying to tease out, should we be concerned? Is this real? And the answer is, we don't know. So some of us are thinking maybe this was a false negative test, so that when these individuals who had the infection then tested negative, was that truly a negative test? We just don't know, but that's one theory. If it is true that they actually did get reinfected soon after recovering, then that is concerning, and it confirms some of our suspicions that immunity is different depending on the individual. We think that most people produce antibodies if they've been infected. Some do it better than others. Some have the better type of antibody that can inhibit viral replication. And so it all suggests that immunity is going to look potentially different depending on the person. But there are some open questions about this, Willie. Was that a false negative test or not, and the implications?
Well, and Mika, that's one of the problems with having a patchwork approach to testing, as the FDA was forced to do at the end of February. Even the FDA now admitting a lot of those tests are junk. So we can't really look at a false positive. We can't even look at a positive now if somebody gets reinfected, and as the doctor was saying, can't even be sure that was a real positive. It may have been a false positive.
We're not where we need to be, as Fauci says, and it looks like we're in a bad place with that. Dr. Dave, Sharon on Facebook asks this: will temperatures be taken every time a teacher or child goes into a school? What's it going to look like?
Temperatures being taken every time a kid goes into school and a teacher is better than nothing, but we need massive testing. As Dr. Fauci and others have said, we need massive viral testing so that we can know if the child or the teacher is in the asymptomatic but contagious phase.
Dan Hilferty, there are many concerns right now when it comes to medical costs, especially for those who recently lost their jobs due to the coronavirus. They have no money coming in. What do you tell to customers who can't afford to buy their own insurance?
Mika, that's a really good point. What we have done is for our insured that may lose their job, may be furloughed. Number one, we've offered a grace period for them to think through this. Number two, we lay out for them that if they fall now in their new income level below 138% of poverty, they're able to join a Medicaid managed care plan. Our plan, AmeriHealth Caritas, is in 28 states, very effective. Also, if they resubmit their income and they may fall into one of the Affordable Care Act subsidized programs that are affordable for them. But we are working on a daily basis with them.
Dr. Dave, I wanted to ask you this question because I saw it scroll across the bottom of the screen, and I know it applies to you directly. Bob asked, when can I feel safe going into a doctor or a dentist's office just for a regular checkup or for routine care? What do you think that looks like? And do you suspect that will also be somebody coming into your doctor's office with their temperature taken first? How does that work?
Yeah, it absolutely affects me. We have 12 to 18 months before we hopefully will have a vaccine. In the meantime, we know this is a very contagious virus. So when you are going for routine visits, doctors, dentists, my belief is everybody has to have a mask on, everybody has to have gloves on, and absolute strict infection control processes for the next 12 to 18 months.
All right. Willie.
Dr. Ramoy and Dr. Gupta, will get you both in on this. Lou on Twitter writes this: when will antibody tests be available for the general public? Does having the antibodies mean I cannot affect others? Dr. Ramoy?
So there's a very big difference between having an antibody and being immune to a virus. And I think that this is one of the things that people have been trying to work out. Now, antibody suggests that you have been infected already, and so these antibody tests will let you know, have you had it before? They will not necessarily tell you at this point whether or not you are actually immune to it.
Dr. Gupta?
Thanks, Willie. I'll amplify everything that Dr. Ramoy just said and just say a positive antibody test or a negative antibody test should not be the premise by which we return people to work. You can be positive for COVID-19 antibody 10 days after symptoms, but still have virus in your nostrils up to 21 days after symptom onset. So we need to be really careful in deploying this test broadly.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.